Hi everyone, my name is Monica.
My name is Annalyn. And my name is Serena. We are dental hygiene students from Del Mar College.
And we are here today to provide you with information on how to take care of your oral health while managing your diabetes.
Did you know that 10.5% of the US population has diabetes? Also, did you know that diabetes and medication side effects can cause problems in your mouth? An example of this would be dry mouth, and we're going to talk about this later in our PowerPoint.
So let's dive deeper into diabetes and oral care. So an early stage of periodontal disease is gingivitis. And gingivitis is caused by the buildup of plaque. And plaque is a white, pale yellowish film that builds up on your teeth when regular brushing is not performed. Inflammation of the gums also occurs. Gingivitis is often painless. Signs of gingivitis consist of red, swollen, bleeding gums, and bad breath. Gingivitis is reversible if treated. An advanced stage of periodontal disease is periodontitis. It too is caused by plaque. Periodontitis involves bone loss surrounding the teeth. Pain is not common in periodontitis. Signs consist of recession of the gums, root exposure, formation of pockets, shifting teeth, and a major cause of tooth loss in adults. Periodontitis is irreversible, therefore lost bone cannot be regained. Periodontitis and root exposure. With periodontal disease, gingival recession can occur. When this occurs, the tooth root surface is exposed. The risk of root caries is increased. Plaque biofilm and sugar can contribute to root caries. Dry mouth also contributes to possible root caries.
Now we're going to look at some risk factors for periodontal disease. And the first one is tobacco use, and the other one would be dry mouth, also known as xerostomia. So scientific evidence supports that smoking has an additive effect on the progression of periodontal disease. Smoking is also harmful to healing after periodontal therapy. If we look at smokers versus non-smokers, the incidence of periodontitis is 4.9% for never smokers, 10.5% for former smokers, and 15.6% for current smokers. So you can see that the incidence of periodontitis is the highest in people who currently smoke. Looking at the bone and tooth loss in smokers, heavy smokers do show a greater risk of tooth loss over non-smokers and lighter smokers. The alveolar bone height can be significantly reduced when comparing smokers versus non-smokers. And so right here above the apex is the alveolar bone, and this is what it is right here. And so the alveolar bone is important in helping your tooth stay in place. And so this is what can be reduced whenever you smoke. So that's why it's important, because it helps hold your tooth in place. So you don't really want it to be lost. So why does this happen? Researchers have suggested that this destruction of surrounding healthy periodontal tissues comes from an altered host response due to smoking. So in other words, smoking can damage the normal functions of your body's response to infection. And when this happens, your body isn't able to stop or neutralize the infection. So moving on to dry mouth or xerostomia, it is a common symptom of type 1 and type 2 diabetes. High blood sugar levels and medications used to treat diabetes can cause your dry mouth, but there is good news. There are ways to improve your dry mouth symptoms. You can improve them by drinking a lot of water, using an alcohol-free mouthwash, chewing sugar-free gum, brushing your teeth 2 times a day with a fluoride toothpaste, and also using a Biotene dry mouth oral rinse. If blood sugar levels are the reason that you have a dry mouth, you would want to consume low sugar foods and drinks. Consume foods high in fiber, Make sure you're taking your medications as prescribed, and also make sure that you're monitoring your glucose regularly. But all in all, dry mouth is typically manageable. Being able to control your blood glucose levels can be your best tool. It's also important to make sure that you're making regular trips to the dentist. That way they can help in treating your dry mouth.
There is a direct relationship between glycemic control and adequate nutrition. The glycemic index ranks food based on the effect it has on blood glucose levels. So this chart here shows foods with a high glycemic index, a moderate glycemic index, and the low glycemic index. Foods that have a high glycemic index, such as popcorn and cornflakes, can cause increased insulin resistance. Foods that have a low glycemic index, such as apples and peanuts, can improve glycemic control and decrease insulin resistance. So in other words, the lower the glycemic index, the less the demand for insulin. Having a healthy, balanced diet is essential to maintain good glycemic control. One of the best ways to achieve glycemic control is to monitor your carbohydrates intake. Good carbohydrate sources include vegetables, fruits, whole grains, legumes, and dairy products. So for fiber, the dietary fiber recommendation for the general public is 25 to 30 grams per day, and that should be incorporated into your daily diet. Fiber may have other benefits, such as helping to reduce systemic inflammation. Omega-3 fatty acids are recommended because they have beneficial effects on lipoproteins and help to prevent heart disease. So when you have sugary, processed, and starchy foods, it combines with bacteria in the mouth and creates acid, which can then eat away your teeth, and this is a process we call dental caries. To help prevent the further progression of dental caries, karyostatic foods should be included in the diet. And karyostatic foods are foods such as cheese and nuts. Additionally, xylitol sugar-free chewing gum is also something you can use. It helps to stimulate your salivary flow, which can then help to wash away the plaque and debris that form when you eat. Eating more fresh foods like fruits and vegetables will help to prevent acid attacks on the teeth and will improve glycemic control. Some additional nutritional considerations are to have a multivitamin daily to acquire additional nutrient intake and to include karyostatic foods in your daily diet.
Now we're going to identify some different dental aids, and there are many different dental aids out there besides flossing, and today we will be going over 3. The first one are these interdental brushes. This is an alternative to flossing. They can help reduce interproximal plaque, which is just plaque between your teeth or food stuck in between your teeth. They can reduce bleeding. They're fast, they're easy to use. They can also be used to clean implants, clean around your implants, orthodontic appliances, and they're also good for people with limited dexterity. So now we're going to show you guys a video of how to use these interdental brushes.
Distance doesn't have to stand in the way of date night. Order your favorite.
Now, once a day, you should make time to remove the plaque from in between your teeth. This is especially important to maintain the health of your gums. I will be showing you the TP interdental brushes, different colors and different sizes, and you want to have a tight brush in between every single gap so it picks up as much of the plaque as possible in between your teeth. I will just show you on a model here how to use the interdental brushes. We will start with one of the smaller sizes, which is the orange. You pass the brush in between the teeth at the gum level and push it in between the teeth 10 to 15 times. And you should be cleaning in between every single gap. If you notice it is a little bit loose, you can work up to a slightly larger size brush to clean in between the teeth. If you find there are some areas at the front which you cannot pass these interdental brushes through, then you may want to use floss instead. You can either take it as a length from the box, or you may find it's useful when it's mounted onto one of these. What you do is pass the floss in between the teeth that you are unable to get the interdental brushes to. Sometimes if the gap is too small, or if the brush is too large for that gap, you may find that the brushes can bend and break. In that instance, you should use a slightly smaller brush, or you should discard that one and get a new one to use. You may find when you first start using them, you get some bleeding of the gums, okay? But after 2 weeks of using them regularly, you will find that bleeding will reduce. So today I've been demonstrating with the TP interdental brushes. There are also other interdental brushes available, and you may find they have different color schemes. So be careful when you're choosing between the brands that you use the right size. Okay, so to wrap things up, it's important that you brush your teeth twice a day with either a manual or electric toothbrush for 2 minutes at the beginning of the day and the end of the day. At least once a day, you should be brushing in between your teeth. You can use floss in areas which you can't reach with the interdental brushes, but the best thing to do to remove plaque from in between your teeth is to use the interdental brushes, which I have demonstrated. I hope that's been a really useful demonstration on how to brush your teeth.
Okay, so the second one would be these floss holders, and she did briefly show these in the video along with the interdental brushes. And this is another alternative to flossing. They are very convenient. The only thing with these floss holders is that they don't allow you to reach all of the areas that regular floss does, but they are still really good at getting the plaque from in between your teeth. The last one I'm going to talk about is this Waterpik Oral Irrigator, and this is good at removing food stuck between your teeth as well. It does reduce gum disease and bleeding. It's up to 51% more effective than regular dental floss for reducing gingivitis. It uses water pressure to massage your gums and push food away from the teeth. It's also a good choice for people with braces and limited dexterity. And here's another video that just shows you how to use the Waterpik.
Brushing alone is not enough. If you just brush, food and debris get left behind. The Waterpik Water Flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into a handle. If this is your first use, you will need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with the lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik Water Flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth with the Waterpik Water Flosser.
Okay, and now I'm going to show you a video on how to brush your teeth.
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium-texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Okay, so like the video said, you want to place the bristles on the gum line at a 45-degree angle, and you'll have the bristles contacting the tooth surfaces and the gum line, and use back and forth brushing motions. And to do the front teeth, you're going to hold the brush vertically and use up and down strokes. And you also want to make sure that you get all the biting surfaces.
So flossing. Flossing should be done at least once a day, and flossing helps to remove plaque and food particles where a toothbrush cannot reach. So basically, you'll wrap the floss around your middle fingers. You're going to pinch the floss between your thumb and your index fingers, leaving about 1 to 2 inches in between. You're going to gently floss in between your teeth using a saw-like motion. Use your index fingers to direct the floss between your teeth. Wrap the floss around your teeth and just move in an upward motion. And here's a video on flossing. So basically, you're just going to gently slide the floss in between your teeth. You're going to wrap it around each tooth and just move in an upward and downward motion, removing all the plaque and biofilm in between your teeth. So how many times a day should you brush your teeth? You should be brushing your teeth at least 2 times a day.
So true or false? Alcohol-free mouthwash can help improve your dry mouth. And that would be true. And this is just a picture of Listerine Total Care, and it says 0 alcohol. So that's how you would know it's alcohol free.
Are foods with a high glycemic index good for your health? No. Foods with a high glycemic index can raise your blood sugar and insulin resistance.
So what we want you to take from this presentation is remember to brush your teeth at least 2 times a day and floss your teeth at least once a day.
Also, working towards tobacco cessation would lead to a healthier mouth. And remember that dry mouth is manageable.
Make sure you are choosing healthy food choices to improve your overall well-being.
And that's all we have for you. Thank you for listening. And that's it.
Bye.
Bye.